In our other top story tonight, a new study reveals an alarming number of teenagers say they've been diagnosed with at least one concussion. Now Oregon leading the way, trying to reverse that trend.
Our Andrew Dimbert joined us now with this health alert. What did you find out here, Andrew?
Yeah, well, Jennifer, Jeff, before this study by the University of Michigan came out, some experts I spoke to said that they believe the number of teenagers that had a concussion was somewhere in the 10% range. Well, this study suggests that it's actually double that. But for years now, high school athletic associations in Oregon have been working with doctors and coaches to minimize that risk. A surprising number of teenagers, 20%, mostly student athletes, have had at least one concussion, according to a new study.
It's accurate, believable, it's certainly shocking.
20% is roughly 1 in 5 teens, or about 10 boys on a 52-man football roster, or 2 girls in the starting 11 for a soccer match. Dr. James Chestnut is a board-certified specialist in sports medicine at OHSU.
I think it's multiple factors. Some of it is kind of a reporting bias that now we're reporting more. And some of it is, I think it actually is increasing the incidence.
Concussions are nothing new, not even at the youth level, but our understanding of them is always evolving.
Football's number one, but women's soccer now is a very close second and soon to be about equal.
She'll deliver another!
Experts fear concussions could lead to CTE, a degenerative brain disorder with symptoms of memory loss and even suicidal thoughts. That's why OSAA, the regulating body for high school athletics in Oregon, is working to reduce them.
We were one of the first states to work along with Washington to prevent kids from going back to play on the same day that they've received a concussion.
OSAA has strict rules and guidelines for coaches, athletic directors, and trainers when it comes to concussion preparedness. Still, there will always be an inherent risk in physical sports.
Certainly there are risks involved with participation in any activity. But trying to minimize those risks and doing everything we can to make the game as safe as possible.
Yeah, and just this month, OHSU received a grant to continue to study brain injuries as it relates to sports. Jennifer, Jeff.